anxietycenter.com.
Okay, thanks for having me on the call. I think you remember my story. I mean, I've been around long enough.
I do remember your story, yes.
You're the bravest guy at Anxiety Center.
There you go.
The bravest guy. Everybody knows you. You're our hero.
Oh, great. Yeah. That's wonderful. Well, I do have some good news on that other, that sexual thing. I just kind of, I just kind of said, if you're going to take me out, you're going to take me out. I'm not going to pay any attention to you. I'm just going to, live like a normal human being, realize that, God created man, with sexual urges, sexual desires, and whatever the, repercussions were on my nervous system, so be it. And I'm not going to say that it just was fine and dandy after that, but, that fear kind of went away. And, it does every time I do have, sexual activities, I do still get revved up. My body still lets me know, but that fear is like no longer there. Well, it's been reduced significantly, okay. To the point where it's not on my mind all day. Like, oh no, I gotta, what am I going to tell Michelle? And, and what is Michelle going to do when I, get home? And is this, and oh no, this, and oh no, that. So yeah. That's good. Good. But, right now, I've reduced my Depakote, which is the only, I'm on two medications. I take Depakote and I PRN, Propranolol, and I don't really take that much. That's just a beta blocker. Mm-hmm. And I don't really take that a lot. I just take it here and there. But anyway, the Depakote, which, it increases, it allows the body to increase its GABA production. So obviously, I don't want to say just like benzo, but, much like a benzo, when you decrease that, your GABA level is going to go down and your glutamate is going to go up. And my psychiatrist and I was on 1,000 milligrams to start, and my psychiatrist and I and a couple others kind of came to the conclusion that I was taking too much, because when I took that 1,000 milligrams, I would get the opposite effect. I'd get stirred up. I'd have an anxious reaction. I'd have lots of, my body would get revved up when it should be doing the opposite. So we thought, okay, that's paradoxical. We need to reduce that. So we reduced that to 625 milligrams. And, right now I do feel like I am withdrawing off a benzo. I mean, I'm not withdrawing off a benzo, but I feel like I'm in some kind of benzo withdrawal. I have plenty of benzo buddies and benzo friends and antidepressant withdrawal friends and all that. And just from listening to all the symptoms and everything, I'm there. I got it. So just like the last caller, I forgot your name, I'm sorry, but trembling. Yeah, I mean, severe trembling, all day panic. So anyway, got the Depakote reduced, and I think I posted a question in the forum for you, and I got your answer. I mean, I get it that, until I clear the medication, that things won't really improve for me on a healing. But my question is this, I started to really have some adverse effects when I made the drop to 625 milligram about 3 weeks ago. And they were drastic. Depersonalization. I mean, just a wild ride. And then it smoothed out. And knowing me, you know me, I continue to work every single day. I continue to live my life. I bought another hot rod, started tinkering with that. Yeah. And, I just started taking my dog for walks. And I was washing my car. This is a big question I had for you. I was washing my car at one of those coin-operated car washes, where you have the spray gun and you spray the car off. And the soapy water that you use to spray the car off first was very overwhelming as far as fragrance. And I know that there's, tons of detergents and stuff in that water. And, I could see the mist. I could feel it going into my nose and into my lungs. And, I just I didn't really think nothing of it. But I did think, wow, this might, kind of mess me up for a minute. But ever since then, I have been in one of the most hellacious waves, and I'm just wondering, have you ever heard of situations where people are kind of in a withdrawal situation where they can aggravate their nervous system substantially by like chemical smells or chemical just detergents or just anything? I mean, not I guess anything short of actually like drinking alcohol or smoking marijuana. We don't do any of that here, but is that something that you've heard of before?
Well, it's common for hyperstimulation to cause a person to become hypersensitive. It can be to sights, sounds, smells, whatever it is. So that can be a factor. And if your body's adjusting to the change in dosage, that can be a factor, because anything we do chemically to the body has to have time to adjust to. So that can be a factor. How has your anxiety and stress been over the last, say, couple of months?
Well, that's I've been working on it, and I can't tell you, it's I got it licked, but I certainly have had this attitude that, hey, look, I know that freaking out about it is not going to get me anywhere. That's going to send me in the opposite direction. In fact, it might put me right back in the hospital and on more medication. So it's like, okay, we don't want to do that. So get used to this. Learn to live with it. It's something that you're going to have to live with. And this is what it is for now. That's the overall attitude. But there are times in the day where it's like, oh my gosh, I still have 625 milligrams of this stuff to get off of. I feel like this now, which would lead into my next question, but I still want to answer your question. As I reduce this medication, is Jim telling me that, that's the, suffering will get, more intense, worse and worse, and there will be no stabilization of, I get those all the time. As far as the anxiety, it's just about coming off this medication. I know I can heal. I've done it like 3 other times. Mm-hmm. Yeah. But, it's this one instance. It's like, okay, I had COVID. I reacted to those antibiotics before that. Okay, now I'm on this Depakote stuff I shouldn't have never even got on. Now I got to reduce this, and now what is this going to do? That there is the number one focus, and I do my best to kind of just, hey, look, get through the day. Let's focus on getting to 500 milligram. Let's not focus on jumping off. Let's focus on getting on to 500 milligram or 550 or something. Yeah. So the answer to your question is probably a back and forth, teeter-tottering between 50%, 60%, anxious about the whole situation.
Yeah, totally. And what about stress? Has your stress been able to come down over the last little while?
It has. I mean, had a pretty big argument with a family member like last week, just before this big wave, which I did contribute to probably, it's like, well, that probably contributed to this huge wave. But
sure.
As far as the stress, just work, work isn't really that bad. I work kind of like pawn shop type jewelry and loan place in the small part of, a country town. And I run the place, but it's not overwhelmingly stressful.
Okay. Would you say a lot of your stress is coming from how you feel?
Well, yeah. I mean, that's another thing. I mean, when the symptoms ramped up after I made the reduction in the Depakote, I mean, I was already, the last call made me famous about all my, the other things, I was pretty stressed out about that. But now I've kind of just moved on to this reduction in the Depakote and going through like a cold turkey. I call it a cold turkey scenario, where it's like, I hear about these people who reduce and they have symptoms and they still plod along and they're able to function. But the ones who just kind of jump off their medications are the ones who are, in severe withdrawal, and
Yeah.
I kind of feel like that. So yeah, I do a lot of what I don't want to say freak out, because I want to give myself some credit, Jim, but
Yeah.
a lot of what I do kind of think about is like, how I feel, because it is weird and wacky. Not only do I have the physical, trembling and akathisia and like all day panic and stuff. I got the weird depersonalization. I call it psychosis feelings. It's not, I don't hear things. No one's telling me stuff through the television, and I'm
Yeah.
not seeing stuff, but it's just, I don't know if it's that derealization, depersonalization is so strong and thick that it just makes you feel like you're losing your mind,
Yeah.
So it's those symptoms that, yeah, geez. And this is all tied to my pride and joy of my life. It's my daughter. I think about her, and then I think about these symptoms sometimes, and yeah, it's like, oh Jesus, how am I going to get, through this for her and myself?
Yeah. Yeah. Well, as you know, yeah, there's a real fine line between healthy level of GABA and too much, because too much GABA can do all the same things that not enough can. And I think it was an astute decision to see you're on a lot. And so, that's a pretty big cut from 1,000 to 600, if I got that right. You said you cut from 1,000 per day to 600 a day?
Yeah, we went from 1,000 to 750 in a month, and then right after a month, we went to another 125 after that. So yeah, it was 5 weeks total that I went from 1,000 to 625.
Yeah, that's a lot. Yeah. And everyone's going to react to withdrawing from medication differently. So there's no one size fits all, especially with medications that affect GABA. And so the good news is, well, again, I don't know where you are in working on level 2 recovery concepts, because as you know, we do not recommend coming off medication until that area is addressed, because if the behaviors are still there that's causing anxiety, you can come off a medication, go through all the the bumps and the hurdles to finally stabilize, but then it's not long before those behaviors cause stress again, and you're right back to where you started. So it's real important to get at those underlying factors, so that when you are finally clear of the medication, your body is not being overly stressed by those behaviors. So if you have done that level 2 recovery work and you are ready to come up, great. Then it's just a matter of working through the various cuts. And yeah, it might take a while, but as you get closer to 0, you should find a lot of the symptoms caused by the adjustment to subside. That's the good news. It doesn't get worse.
Okay.
Yeah, it doesn't get worse. It kind of slowly gets better, especially as the body comes closer to the natural production of GABA. So,
okay, well, that brightens my day.
yeah.
Sure.
Now, you will see a lot of horror stories, and you'll see that for anything, just because a lot of times people, when they come off of these things, they haven't done level 2 recovery, or they're not even aware that level 2 recovery exists. And so a lot of it's caused by behavior in reacting to the withdrawal causing symptoms, and then reacting to those symptoms. So a lot of that stuff just perpetuates everything. So you're well aware of anxiety, what it can do. And if you worked on level 2 recovery concepts and you're just tapering down, you should be fine in time. I'm not going to say you're not going to have bumps, because you probably will, but as your body adjusts, you should be fine. If you haven't done your level 2 recovery work, I would encourage you to do that as you're making these final, steps down. Because again, it's always going to be our unaddressed underlying factors that cause rebounds every single time. Again, coming back to that basic equation, cause and effect. Anxiety causes stress, stress causes symptoms. If you want to get rid of the whole thing, you've got to address the anxiety behaviors so that your stress comes down. And as they both come down, symptoms go away. And so whenever we have lingering symptoms, it's always going to be tied to stress somewhere. And if we're having stress and we don't know, if we're not aware of what's causing our stress, then it's an underlying factor. So that's what I'd encourage you to do. And you were working with a therapist for a while, and if you have addressed those things, then again, you should be well prepared to come off, just go through the bumps, and when you stabilize, you're going to find things are going to be way easier for you.
Yeah, I was working with Stacy, and I know we all love Stacy. I love Stacy too, and I'm not here to throw him under the bus, but I got a hold of him again, and I told him what you told me, that look, we need to work on level 2.
Yeah.
And I I'm here to employ you to work on level 2. And he said, well, I can't work on level 2 until you work on level 1. And I said, well, what does that mean? And it's, well, you know what you need to do to calm down the nervous system, and then we can work on level 2. And I said, well, that kind of contradicts exactly what Jim said. And I'm like, but I'm not going to make a big deal out of this, because it's two different people, and I'm in the middle, and I'm kind of been forced to work on the level 2 myself through your materials. And I know them, I've listened to, I when you said you were going to just help with the other caller, I forgot her name, I'm sorry. But just with her and her husband, I kind of got a little bit jealous, which is an underlying factor. But I was like, geez, how lucky is she? She gets, she's going to get Jim to help her. And I even remember, you used to be a counselor years ago, so it's like, okay, if I got to do these underlying factors, for the time being, I think I'm pretty much on my own, because, I just, unless I work with Doug or, somebody else, I'm not really going to get much out of Stacy.
Interesting.
And again, I'm not bad mouthing Stacy at all, but, he kind of just straight up told me, like, I can't help you.
Interesting.
Without helping yourself first on level 1.
While editing this section, I wanted to clarify a common misunderstanding about our approach to anxiety disorder recovery. It's not that you can't work on level 2 recovery until you've completed level 1 recovery work, but that you need to have some proficiency and are actively working on level 1 recovery skills before starting level 2 recovery. For instance, you should be reducing stress, doing regular deep relaxation, containing anxious behavior, passively accepting your symptoms, and working at becoming unafraid of your symptoms at the very least. That's because as the body's level of stimulation diminishes, symptoms diminish, and the brain is more able to learn and process cognitive information necessary for level 2 recovery. So again, it's not that you can't start level 2 recovery until you've completed level 1 recovery, but that you should be actively working on level 1 recovery before starting level 2 recovery. I think that's what Stacy meant. That means you can be working on both levels of recovery at the same time, as long as you are actively working on level 1 recovery strategies. So my recommendation is to start level 1 recovery, and when you've had some time with it, start level 2 recovery and work on both together.
And so it'd be going after the behaviors. Because, here's the thing. If you are having a medication that's stirring your body up and it's symptomatic, and you're doing level 1 recovery work to try to dampen down those symptoms, well, you're not going to get a whole long distance, because the medication is actually the cause of this stimulation and symptoms.
Right.
And so, this is why we prefer that people don't start medication, because medication always throws another layer of complication into the mix. I understand that a lot of times people come to us, their bodies are so stirred up, they just can't settle. And they want to be able to do the recovery stuff, except that the body is so wired they just can't do it. So I understand why people start there. But the problem is, a lot of times when you start there, if a person starts to see some progress in terms of symptoms coming down, then they don't do the level 2 recovery work because they don't see the need. And so then when they want to come off the medication because they've had enough, all of a sudden it's not very long before they're back to where they started. Or the other scenario is when the symptoms aren't coming down enough because the underlying factors are still causing the stress, and the doctor wants to see symptom improvement, so they'll just either increase the dose or prescribe a different medication or multiple medicate, and then you get on that roller coaster. So it's better that people, come work on the recovery strategies, get their bodies settled naturally. Then as you're working at the level 2 work, there's a more of a natural transition, so you don't have to deal with coming off of medication interfering with your natural ability to combat, all those things. Now, nevertheless, I understand there's a whole lot of different ways people get into this and the help they get on the way here. So in your case, if the medication you're taking is causing some of the physical upset, which it likely is, it would be real difficult for you to succeed at level 1 recovery and find the kind of success you're looking for, because your body's being interfered with by the chemical. So coming down is a good thing. But if you haven't done the level 2 recovery work, again, It's going to make this process more difficult because you're going to be still reacting to it somewhat degree. Even if you have level 1 recovery skills to a good portion, you still have the underlying factors that's going to drive the anxious behavior and gets that stuff going. All right, so what's the solution? Well, since we're working on level 2 recovery concepts for the recovery support area, it's going to be a long time before everything's up, just because there is a lot of information coming. And it takes time to formulate and program and so on and so forth. So I don't think that's going to be much help to you in the short term. It might be worthwhile to connect with a different therapist and explain your situation to the therapist about what you're doing. And if you like, you can have that therapist contact me and I can give them a brief overview of what's going on and what the recommendations I would have. They would be able to help you with level 2 recovery stuff. That way, you could still get the help you're looking for. The other thing I could do, if you're interested, I could talk with Stacy. And because you already have a history there, he would know your background. I could also talk with him and provide some direction to him or you, depending on what he says, if that's of interest to you.
That's definitely interesting. Yeah, I'd like to keep it with Stacy because I've worked with him, before, and he knows pretty much now. I mean, but there's another thing though. It's just like Stacy, and I'm not mouthing Stacy at all. He's a wonderful guy, probably the best guy you got. Everybody loves him. But
yeah, he does, yeah.
It's hard. Like he told me to come off the Depakote like in a month, like the entire 1,000 milligrams. And right away I was like, I didn't tell him anything. I just said, oh, okay. But I knew right away I can't do that. And so it's just one of these things where it's like, geez, I have trouble, I don't know. It's like not trouble believing or, buying into what the therapists are saying.
Yeah.
It's just, it's just a tough route for me. It's like, yeah, I don't know, what to do. It's those 3 options you gave me. It's kind of, I almost have to flip a coin for it.
Yeah.
But,
yeah, well, it is surprising to me that he would suggest you could come off of that within a month. Because, that's
well, he said that Lexapro too, and I'm not here to, again, I can't say this enough. I'm not here to throw him under the rug, but I feel like, we're talking about this, and, there's only 3 people, including myself, on the call here. And, he's a wonderful guy, but, it's almost like he's, just like a doctor, which, they don't understand too much about tapering either, but that's not his fault, and I'm certainly not holding that against him at all.
Yeah.
So,
During this discussion with Jeff, I was surprised to hear that Stacy had recommended coming off of Jeff's medication so quickly, since our team of recommended therapists has had numerous discussions about medication and withdrawing from it, and that's not our recommendation. Our recommendation is that a person should never stop a psychotropic medication cold turkey or abruptly, such as within a few weeks. All our recommended therapists agree with this recommendation, and I knew Stacy did too. So I talked with Stacy about it, and there appears to have been a misunderstanding. Stacy said that he mentioned to Jeff that a standard tapering protocol is to cut a quarter, then stabilize for a couple of weeks, then cut another quarter and stabilize for a couple of weeks, and so on until the medication is discontinued. But he also said that Jeff should discuss an appropriate tapering protocol with his doctor. Jeff mentioned to me in an email that his doctor agreed with that standard approach. Personally, I would have suggested a slower approach with less severe cuts because I also agree that the initial dose of Depakote Jeff was taking was too much to begin with. However, we always recommend talking with a doctor or a pharmacist for the most appropriate discontinuation strategy.
Well, let me pray about this and think about an approach. You're at the discussion forum. I can PM you through there about possible options. Just so I get a more complete picture, are you on any other kind of medication at the moment?
The only thing I take is when the akathisia gets just so bad and the inner trembling gets so bad, I take like 20 milligrams of propranolol, and it seems to just take the edge off. I don't really I take it PRN. I've done extensive research about it. Other than asking you what you think about it, and I know you're not a advocate of medication. It's just a beta blocker. It doesn't really affect anything else, so I'm told. And, as long as you're not taking it every single day for months on end and then just stop cold turkey, you won't have any issues with it.
Yeah. If you're taking it occasionally, especially with, the other thing that's going on there, probably not harmful. Yeah, I think I would need a bigger picture. Do I have your permission to access your background profile and some of the notes that Stacy took?
Well, absolutely.
Okay.
100%. Yeah.
Yeah, I'd like to get a better understanding of what's going on there so I can give you some ideas in terms of what you can do to move forward.
Sure.
All right. So I'm sorry.
Go ahead.
I'll actually what I'll do is I think I probably have your email address direct. I'll probably email you directly rather than through the discussion forum, and we can chat a bit further through that if that's okay.
Absolutely. Yes. 100%.
Yeah, I want to see you get through this. I mean, you spend enough time dealing with anxiety, so let's get you to home plate here.
Yeah, and it's, I feel like this is the grand finale. I mean, I've never felt so bad. I mean, I know I said that in the last call, but this time it's just as bad. But I've but I've significantly gotten better in one area, and then another area has gotten significantly worse. And I know that's just from coming off the medication.
Yeah.
And I know we're up against the clock here, but just one quick, when I'm tapering this medication, okay, I've got a taper plan.
Yeah.
And it's not going to be too slow, but it's not going to be too quick.
Yeah.
It's going to be 10% increments of, the current dose, not the original dose, with holds. Now, in your opinion, and I mean in your opinion, can stabilization, and stabilization doesn't mean I feel great.
Yeah.
Wow, I'm good. I can stay here for the rest of my life and I'm good. It just means, you're feeling better and a little bit more stable. Can stabilization happen, while you taper and hold? Like, for instance, I'm on 625 right now. I'm feeling like crud. Yeah. I start, not start, but, continue reducing the stress and just kind of getting a holding pattern. And, with the strategies and everything, the body will feel better. And then I can taper some more. And then I obviously get an uptick, then back to that stabilization. Yeah, I think you already answered the question about the lower I get, the better I should feel on this GABA drug.
Yeah.
But in your opinion, I mean, stabilization it's not going to be like this because I'm on 675, and the only way through this is to continue to taper and just go through hell on earth until I'm off that and then some.
Well, that's the $1 million question, because each body's going to respond to that uniquely.
Yeah.
And so there's really no way to tell you exactly what to expect other than to say expect anything.
Right.
Until the body is back to normal health, the body's producing natural levels of GABA, and we're containing well despite how poorly we feel, and that adding to the mix, the body will stabilize and will feel way better. But the journey there could be rough, and it's going to take a lot of containment skill. It's going to take a lot of acceptance. There can be times when you feel just absolutely horrible, but then they usually abate a little bit. But again, it can be anything. And some people don't notice anything. Other people notice a lot. So it's really going to depend on what your body does with all that.
Right.
Yeah.
Okay. Yeah, because I've heard it from both sides. I've heard, on the benzo community, I've heard, people don't stable when they're tapering, and some do and some don't. And it's just it's a mix. It's almost like a 50-50 thing. So.
Yeah, that's the thing. It's, there's just no, because each body is somewhat chemically different, it's just going to respond. And of course, the biggest thing too is how we react to it. Behavior makes a big deal too. I think one of the things I did probably, that I thank myself for now way back when is I just kept myself absolutely neutral. No matter how bad I felt, so what? That was just how it was, and I just moved on. So
that's exactly what I try to do on a daily basis.
Yeah.
Whether I succeed or not, that's another thing. But I like to think that I succeed possibly a lot more, or at least a smidge more, than not. So
yeah, and I like the brilliant statement you said earlier about it's not being perfect. It ain't. Yeah, it's about trying to do the best you can and doing better than you do worse, because it's going to be both at times.
Right.
Yeah, because this is very similar to coming off a benzo, right?
Very. I mean, I've been in the community a long time. I've talked to a lot of people, both antidepressants, benzos in particular, and this is exactly this is exactly what I see. I mean, this is exactly how I feel.
Yeah.
And
because the problem with having an artificial GABA is that it stops the body from producing natural GABA. So the only insulating buffer we have is what the medication gives us, and of course it wears off at times, and a lot of times the body loses its sensitivity to it. So yeah, it can be rough, and I'm not even sure what to say. I mean, it can be anything, and until you're down to a low dose, you might see benefits. The other thing too is that I noticed, and it's probably not in the materials you see anywhere, but a lot of times we prolong the agony. And what I mean by that is people will cut, slowly endure the harmful effects of the cut and drag it out, thinking that the longer the taper you make, the better off you are. But actually, it's not that way at all. We just prolong the agony by going little bits by little bits, because every little artificial boost we get, it's like the body tops up its reserve. So until we get to that place where we can do a safe stop, and this is where you may want to talk with a pharmacist who will know more about this. Hopefully they do. We're finding out now that pharmacists just aren't as educated as they used to be. They used to be more knowledgeable about medication withdrawal effects than doctors, but now we're finding that even some of the people who have come back to me and said, yeah, I talked with my pharmacist, and they didn't have a clue. It's like, wow, that's really different. But maybe between the two, comments between the pharmacist and the doctor you're working with, you might find that healthy balance. But you certainly don't want to be dragging everything out. Like when you get down to a low place, you just might want to stop and suffer that little bit, rather than tapering down and suffering for months and months and months, and then still have to go through that period.
Right.
Yeah. So you might want to consider what your doctor might think a safe stopping point might be. And then just to say, I'm just going to bite the bullet and stop now, and just go through that period until the body builds its natural GABA. The thing too is, from our materials on the benzo side, is that it can take up to 2 weeks or more for the body to adjust away from having the medication until it starts to be building its own GABA, and you start to feel normal again. Because the thing I noticed, especially with taking the benzo, and I'm not sure how you noticed with what you're taking now, but I found that I could never get my body settled, even with the medication. I would get tired and whatnot, but I'd still have symptoms. I still felt out of control, of complete control of my body. And I never really regained that until my body was clear of the medication and had sufficient time to adjust. Then it's like, wow, this is what people are talking about. This is how you can settle myself down. Oh, this is great. But I never got there until I got rid of that darn benzo. So, might find the same thing with you.
Yeah, and the fear is with everybody is that, if you cut and cut and cut to try to get off to jump on even a safe, you just continue to get worse and worse and worse and worse. And will you be able to handle it,
Yeah.
Well, that's the big fear.
Well, I think, from people who've been through what you've been through, and a lot of us have been through with high degree anxiety and stuff, we've already endured the worst. It's not going to throw anything more at you that you haven't already experienced in other ways. And because you have experience and because you've settled yourself, I think you'll do just fine.
Okay.
Yeah.
All righty. Well, yeah, if you want to get a hold of me, I don't know if, I believe my email is current, so.
Okay. I'll try that, and if I don't hear a response, then I'll buzz you through the discussion forum PM.
I wanted to add that having good level 1 and level 2 recovery skills can make a world of difference when discontinuing a psychotropic medication. That's why we recommend doing that work, or at least a large part of that work, before tapering and stopping antidepressants and anti-anxiety medications. Having good recovery skills can make the discontinuation process easier, and you have a far greater chance of not rebounding after the medication has been stopped. If level 1 and level 2 recovery work isn't done, research shows that more than half of people who stop antidepressants and anti-anxiety medications restart them within 1 year after they stopped. That can be prevented by having worked at level 1 and level 2 recovery.
Okay, sounds good. Of course, I wish you the best, and you're certainly being a real trooper for going through what you've gone through and endured for all these times, and especially the challenges you've had recently that have set things back, because you've had a lot of stressors. So I wouldn't even be concerned about coming off the benzo. You might have some difficult moments, but again, you've had lots of these in the past you've dealt with. So,
right.
Yeah.
All right. I certainly do appreciate it.
You're more than welcome.